The COVID-19 pandemic turned the world upside down. Millions got sick. Many people died. It's natural to wonder where this virus came from. Finding the source is crucial for preventing future pandemics. It helps us understand how viruses jump from animals to humans. This knowledge is, vital for developing vaccines and treatments. Understanding the origin of COVID-19 is not about assigning blame. It's about learning from the past. We need to know what happened to prevent similar outbreaks. This knowledge is essential for global health security. It's about protecting people everywhere from future threats. However, the search for answers has been complicated. There's been a lot of debate about the origins of COVID-19. Two main theories have emerged: a natural origin and a lab leak. The natural origin theory suggests the virus spread from an animal to a human. This is how many past pandemics have started. The lab leak theory proposes that the virus accidentally escaped from a laboratory. Both theories have sparked intense discussion and investigation. Scientists, governments, and the public are eager for a definitive answer. Uncovering the truth is crucial for preventing future pandemics and safeguarding global health. The search for answers continues, driven by a shared desire to learn, adapt, and protect our future. The lab leak theory has gained significant attention. It suggests that COVID-19 may have accidentally escaped from a laboratory in Wuhan, China. This theory centers around the Wuhan Institute of Virology, which studied bat coronaviruses. Proponents of this theory point to several pieces of evidence. First, the Wuhan Institute of Virology is located very close to where the first human cases of COVID-19 were detected. This proximity raises questions about a possible link between the lab and the outbreak. Second, researchers at the Wuhan Institute were conducting gain-of-function research. This type of research involves manipulating viruses to make them more transmissible or deadly. Third, there have been reports of researchers at the Wuhan Institute falling ill with COVID-like symptoms in the fall of 2019. While these reports are unconfirmed, they further fuel speculation about a possible lab accident. Finally, the Chinese government has been criticized for a lack of transparency in its handling of the outbreak. This lack of transparency has made it difficult to investigate the origins of the virus thoroughly. Critics of the lab leak theory argue that there is no direct evidence linking the virus to the Wuhan Institute. They maintain that the virus could have been circulating in the community for some time before it was detected. The debate over the lab leak theory is likely to continue as scientists gather more evidence and information. The Wuhan Institute of Virology, or WIV, is a research facility in Wuhan, China. It became a focal point in discussions about the origins of COVID-19. The WIV has a history of studying coronaviruses, particularly those found in bats. This research, while important for understanding viruses, has sparked controversy. Some scientists believe that the type of research conducted at the WIV, known as gain-of-function research, carries inherent risks. Gain-of-function research involves manipulating viruses to enhance their transmissibility or virulence. This research aims to understand potential pandemic threats and develop countermeasures. However, critics argue that such research could inadvertently lead to the creation of a highly contagious and deadly virus. They fear that a lab accident could release such a virus into the population, causing a pandemic. The WIV has denied any connection between their research and the COVID-19 outbreak. However, the lab's proximity to the initial outbreak and its work with bat coronaviruses have fueled speculation. The debate surrounding the WIV and gain-of-function research highlights the importance of biosafety and transparency in scientific research. International collaboration and open sharing of information are crucial for addressing global health threats. As the search for the origins of COVID-19 continues, the role of the WIV and the implications of gain-of-function research will likely remain subjects of intense scrutiny and debate. Throughout the COVID-19 pandemic, conflicting information and a lack of transparency from governments and health organizations fueled confusion and mistrust. Early in the outbreak, there was a reluctance to acknowledge the possibility of a lab leak. This fueled speculation and conspiracy theories. When information is withheld or manipulated, it erodes public trust in institutions responsible for keeping people safe. Mixed messages about the effectiveness of masks, social distancing, and the origins of the virus created uncertainty and doubt. This lack of clarity made it difficult for individuals to make informed decisions about their health. It also undermined the public's willingness to comply with public health measures. Transparency is crucial in building and maintaining public trust. When governments and health organizations are open about what they know, how they know it, and what they don't know, it allows for greater understanding and cooperation. This openness helps to counter misinformation and build confidence in public health recommendations. Learning from the COVID-19 pandemic requires a commitment to transparency and accountability. Governments and health organizations must prioritize open communication and collaboration to regain public trust and effectively address future health crises. The world needs accurate, timely, and trustworthy information to navigate global health challenges and protect the well-being of all people. Thanks for stopping by today, Hot Reels. If you enjoyed this video, don't forget to hit the subscribe button and give it a like. Your support helps us bring you more amazing content. Please stay connected with us on Facebook, Instagram, TikTok, X, Pinterest, and Threads for the latest updates and trending reels. Subscribe now and be part of the fun.